NABH, National Accreditation Board for Hospitals and Healthcare Providers. AMBU, Artificial Mechanical Breathing Unit or Artificial Manual Breathing Unit bag. BCG, Bacillus calmette urine. CBC, Complete Blood Count. EKG or ECG, Electrocardiogram. DVT, Deep Vein Thrombosis. CHD, Congenital Heart Disease. CHF, Congestive Heart Failure. CABG, Coronary Artery Bypass Graft Surgery. CLABSI, Central Line Associated Bloodstream Infection. ADR, Adverse Drug Reaction. MRSA, Methicillin Resistant Staphylococcus aureus. SLED, Sustained Low Efficiency Dialysis. SGPT, Serum Glutamic Pyruvic Transaminase. SGOT, Serum Glutamic Oxaloacetic Transaminase. DSA, Digital Subtraction Angiography. STEMI, ST Elevation Myocardial Infarction. NSTEMI, Non-ST Elevated Myocardial Infarction. MCA Infarct, Middle Cerebral Artery Infarct. SD, Seizures Disorder. PES, Problem Etiology, Signs and Symptoms, Medical Diagnosis. DKA, Diabetic Ketoacidosis. GABA, Gamma Aminobutyric Acid. ICDS, Integrated Child Development Services. NANDA, North American Nursing Diagnosis Association. ASO titer, anti-streptolysin O titer. CPDA, citrate phosphate dextrose adenine. VDRL, Venereal Disease Research Laboratory Test. ASD, Atrial Septal Defect. ALD, Alcoholic Liver Disease. ELISA, Enzyme Linked Immunosorbent Assay. EIA, Enzyme Immunoassay. ARDS, Acute Respiratory Distress Syndrome. AG ratio, Albumin to Globulin ratio. ACLS, Advanced Cardiac Life Support. BLS, Basic Life Support. BUN, Blood Urea Nitrogen. ADL, Activities of Daily Living. AFB, Acid Fast Bacilli. HF, Heart Failure. VF, Ventricular Fibrillation. VT, Ventricular Tachycardia. AF, Atrial Fibrillation. PVD, Peripheral Vascular Disease. TIA, Transient Ischemic Attack. CVA, Cerebrovascular Accident. ACS, Acute Coronary Syndrome. AMI, Acute Myocardial Infarction. CVD, Cardiovascular Disease. IABP, Intra-Aortic Balloon Pump. BNP, Brain Type Natriuretic Peptide. LDH, Lactate Dehydrogenase. CPK, Creatine Phosphokinase. PSA, Prostate Specific Antigen. ANCA, Anti-Neutrophil Cytoplasmic Antibodies. CANCAs or PR3 ANCA, Cytoplasmic Anti-Neutrophil Cytoplasmic Antibodies. PANCA or MPO ANCA, Perinuclear Anti-Neutrophil Cytoplasmic Antibodies. KUB, Kidney, Ureter and Bladder. CAD, Coronary Artery Disease. CSSD, the Central Sterile Services Department. INR, International Normalized Ratio. HBsAg, surface antigen of the hepatitis B virus, HBV. AEC, absolute eosinophil count. CRP, C-reactive protein test. FSH, follicle stimulating hormone. ABGAR, A for appearance, P for pulse, G for grimace, A for activity, R for respiration. DX, diagnosis. TAH, total abdominal hysterectomy. SOB, shortness of breath. SDH, subdural hematoma. TURP, transurethral resection of the prostate. SLE, systemic lupus erythematosus. COPD, chronic obstructive pulmonary disease. ANA, anti-nuclear antibody. ADA, adenosine deaminase. PRBC, packed red blood cells. DHS, dynamic hip screw. RBBB, right bundle branch block. LBBB, left bundle branch block. MRCP, magnetic resonance cholangiopancreatography. ERCP, endoscopic retrograde cholangiopancreatography. CRIF, closed reduction internal fixation. ORIF, open reduction internal fixation. Push tool, pressure ulcer scale for healing. VIP score, visual infusion phlebitis score. LAMA, leave against medical advice. ESR, erythrocyte sedimentation rate. DNC, dilation and curettage. NPH, normal pressure hydrocephalus. MLC, medico-legal case. PPH, postpartum hemorrhage. PIH, pregnancy-induced hypertension. PCV, packed cell volume. ENMG, electroneuromyography. FNAC, fine needle aspiration cytology. CECT, contrast enhanced computed tomography. HRCT, high resolution computed tomography. DOTS, directly observed treatment, short course. URSL, ureteroscopic lithotripsy. PCNL, percutaneous nephrolithotomy. GRBS, general random blood sugar. ICD, implantable cardioverter defibrillator. EEG, electroencephalogram. MCH, mean cell hemoglobin or mean corpuscular hemoglobin. MCHC, mean corpuscular hemoglobin concentration. MRI, magnetic resonance imaging. MRA, magnetic resonance angiogram or MR angiography. MRV, magnetic resonance venography. HTN or HT, hypertension. DM, diabetes mellitus. NOF, neck of femur. DPT, diphtheria, pertussis and tetanus. PCT, procalcitonin. HCO3, bicarbonate. pH, potential of hydrogen. VS, vital signs. CT, computed tomography. ER, emergency room. ETA, estimated time of arrival. I and D, incision and drainage. LMW, low molecular weight. PID, pelvic inflammatory disease. UTI, urinary tract infection. APH, antepartum hemorrhage. THR, total hip replacement. TKR, total knee replacement. LRTI, lower respiratory tract infection. LSCS, lower segment cesarean section. PLBS, post-lunch blood sugar. RBS, random blood sugar. LFT, liver function test. FBS, fasting blood sugar. CBP, complete blood picture. TC, total count. DC, differential count. BTCT, bleeding time and clotting time. PS for MP, peripheral smear study for malarial parasites. PT, prothrombin time. AFP, alpha fetoprotein. HCG, human chorionic gonadotrophin. RA, rheumatoid arthritis. HSCRP, high sensitivity C-reactive protein. PPC, puncture proof container. LH, luteinizing hormone. dsDNA, double stranded DNA. IgG, immunoglobulin G. PPE, personal protective equipment. CRRT, continuous renal replacement therapy.